In a field like medicine, where the stakes are literally life and death, how do you even grade success? It's not a simple pass-fail, right? Well, today, we're going to pull back the curtain on something called performance measurement. Think of it as the super detailed report card that modern healthcare uses to get better and save lives.
So let's just start with the big question that, let's be honest, affects every single one of us. You walk into a hospital, you see a shiny new building, but how do you really know if the care is top-notch? How do you measure the stuff that actually matters? That's the exact problem performance measurement is built to solve.
The easiest way to think about it is like a report card for a hospital or a clinic. But we're not talking about a simple A or B here. Oh no, this is a deep, data-driven dive into how well that hospital is doing at its most important job, making people better.
And here's the official, kind of textbooky definition. Don't worry about the jargon. The only words that really matter here are statistical evidence and specific objectives. It just means we're moving away from guesswork and gut feelings and into a world of hard numbers to see if a hospital is actually achieving what it promised to do.
You know, for a long time, accountability in healthcare was pretty much just about the budget. Did you spend the money you were given? Check. But that never answered the real question. Did anyone actually get healthier? This whole performance measurement thing is a huge shift. It's not about tracking spending, it's about tracking the impact of that spending. Are we actually getting better health outcomes?
Okay, but to really get this report card, you've got to be able to speak the language. So let's just quickly run through the key terms. These are the building blocks of the whole system. If you get these, everything else is going to click right into place.
First up, input. This is easy. Think of it as all the ingredients you put into the recipe. It's the money, the doctors, the nurses, the equipment, their time. It's all the raw material you need to even begin to provide care.
So you take all those inputs, and what do you get? You get an output. This is the stuff the hospital actually does. The number of surgeries they perform, the number of patients they see. It tells you how busy they are, for sure, but it definitely doesn't tell you the whole story. Because this is the whole story, the outcome. This is the result, the real-world consequence of all that activity. It's not just that a surgery was done, it's whether the patient's life actually improved. The outcome, you guys, is the entire point.
And this slide just nails the difference. Counting the number of surgeries you did, that's an output. It's just an activity. Measuring the patient's survival rate after those surgeries, that is an outcome. One tracks what we did, and the other tracks did it work. Understanding this distinction is absolutely crucial.
So, how do we track those all-important outcomes? We use something called Key Performance Indicators, or KPIs. A KPI isn't some fuzzy goal like improve health. No way. It's a hard, specific number like reduce post-op infection rates by 15%. KPIs are what turn these big, abstract goals into something you can actually measure and work towards.
But where do these KPIs even come from? I mean, they're not just pulled out of thin air. There is a surprisingly intense and methodical process to create a metric that's fair, that's accurate, and that's actually going to help improve patient care.
I mean, just look at this timeline. It can take over 2 years just to develop one new performance measure. It starts as an idea, then gets super specific, then it gets tested like crazy. They try to find all the weaknesses because a bad metric can cause way more harm than no metric at all. And only then, after all that, is it finally rolled out. And even then, they're constantly checking to make sure it's still doing its job.
So on a practical level, how does a hospital figure out what to measure? A lot of them use this really simple but powerful framework. Research, compare, act. First, you research. What does great even look like out there? Then you compare. Where are we right now versus that gold standard? And finally, you act. Design the right measure, start collecting the data, and build a real plan to get better. All right, that's enough theory. Let's see how this all comes together in one of the most complex, high-stakes fields in all of medicine: stem cell transplantation. In this world, performance measurement isn't just some administrative exercise. It's a critical tool for survival. So what you're seeing here is a simplified version of a real scorecard for a transplant program. On the left are the KPIs. On the right are the benchmarks, the goals they're aiming for. You can even see the goals are different depending on the type of transplant. You should think of this as the program's vital signs. A quick glance tells the doctors if they are on track or if there's a problem.
Let's zoom in on that very first one, engraftment rate. It sounds really technical, I know, but what it's measuring is at the absolute heart of whether a transplant is going to be successful or not.
So what is engraftment? Well, it's the moment of truth. It's when those new transplanted stem cells take hold in the patient's body and start building a brand new immune system from scratch. For the patient, this is, well, it's everything.
And the goal here is for that to happen in over 95% of patients by day 28 after the transplant. This number isn't just a target, it is a lifeline. Every single percentage point below that benchmark represents a real person whose transplant isn't working as it should, and that triggers an immediate all-hands-on-deck effort to figure out why.
The scorecard is also tracking 100-day mortality. Why 100 days? Well, it turns out that's the most dangerous and vulnerable period right after a transplant. So this KPI is a direct, unfiltered measure of how many patients a hospital can successfully guide through that incredibly risky window.
So, when you put this all together, what have we learned? It's that this whole process, from defining terms to building these complex scorecards, it's not about bureaucracy. It's about using data to make healthcare safer, better, and more effective. So in the end, it really all boils down to this. Good measurement makes people accountable and pushes them to improve. It forces everyone to follow a structured process that turns vague hopes into real concrete targets. And every single number, every KPI on that dashboard is aimed at one thing and one thing only: providing better, safer care for every single patient who walks through the door.
And this leaves us with a final question to chew on. We've seen how this intense, outcome-focused approach literally saves lives in medicine. So where else could it be a total game changer? In our schools? In our government? What about in our own personal goals? Just imagine what we could achieve if we started getting serious about measuring what truly matters.